Okay, yeah,
Mm.
okay. Okay, good morning and welcome to UDKL RCMP Hospital. My name is Mr. Muhammad Razik from the Human Resources Department. Thank you for attending this interview for the position of the housemanship officer. Today's interview will consist of two sessions. The first one is individual interview session, where each candidate will be assessed on clinical reasoning, professionalism, communication, and personal readiness for housemanship. So for the next session, which is group discussion, where all candidates will participate together to assess teamwork, insight, ethical value, and professional identity. Please note that the marks will be given throughout the interview based on the following criteria. For the first one is patient safety awareness and clinical judgment, professionalism, ethic and accountability, communication skill and clarity of expression, ability to work within a team and accept supervision, attitude, resilience, and willingness to learn. The interview will be conducted primarily in English. Please answer clearly. If you need clarification, feel free to ask. You may take a moment to think before responding. This is not an examination but a professional discussion.
So good morning, everyone. I am Dr. Rahim Jahid, CEO of UniKL SMP. So basically, our hospital places strong emphasis on patient safety, ethical practices, teamwork, and continuous learning. Basically, housemanship is a period where mistakes can happen, but unsafe attitudes should not. We value honesty, humility, and the willingness to ask for help. So today, we want to see not only what you know, but how you think, how you behave, and how you will respond under pressure.
Okay, so now we will start our interview session for today. So for the first one is candidate one. Please introduce yourself, like your full name, medical school, your year of graduation, and any clinical exposure you feel is relevant.
Thank you so much. My name is Muhammad Naufal Hidayat bin Suhada. I'm a final year medical student at UniKL RCMP, and during my clinical rotation, I've had exposure in several departments, but I found that respiratory and psychiatry wards particularly are impactful for me. In the respiratory ward, I learned to interpret vital signs, recognize acute deterioration, and participate in patient management under supervision. Meanwhile, for my psychiatry rotation, it allows me to develop strong communication skills, understand patients' emotion, fears, and motivations, which is for me is crucial for holistic care. I've also been actively involved in PBL session and case-based discussion, which very much helped me to integrate the knowledge across different medical disciplines. This experience may not only strengthen my clinical reasoning, but it also highlight the importance of empathy, observation, and teamwork in patient care. That's from me.
Okay, thank you, Nofal, for the good introduction. So I have question. What initially motivated you to pursue medicine, and what continue to motivate you today?
I was initially motivated to pursue medicine because I want to make a tangible difference in people's life. For me, growing up, I witnessed how illness can affect not just the physical health of someone, but also emotional well-being and their family dynamics. And for me personally, I want to be someone who could address both aspects, which is from the emotional well-being, and also the physical health. And what continues to motivate me until today is the combination of continuous learning and patient interaction. Because for me, every patient encounter is unique and it teaches us something new, whether it is like a clinical lesson or psychological insight or an interpersonal challenge. I find inspiration in seeing patient regain independence and confidence through the proper care, which is from the physical and emotional aspect, which reminds me why this profession require both skills and compassion. For me, I aim to become a doctor who not only treats the disease but also support the patient in navigating their emotional and psychological challenge of the illnesses.
So Nafal, the
Yeah.
transition from medical student to house officer is often challenging. What concerns you the most about starting the housemanship?
For me, I think the biggest concern is managing multiple patients with varying levels of acuity while ensuring that every decision I make is safe and evidence based. Because in my opinion, housemanship involves long hours, night duties, and responsibilities that directly impact the patient outcomes. So I understand that fatigue, time pressure, and unexpected emergency can make some decision making more challenging. So my main concern is ensuring that patient safety remain my top priority, um, even when facing this pressure.
So Nafal, based on your several concerns, uh, basically what steps have you taken to prepare yourself for this transition?
For me, to prepare myself for housemanship, I've taken several steps, which is academically, I've reviewed common hospital protocols and emergency procedure, and I've participated in simulation session to practice clinical decision making under the pressure. And practically, I've worked on time management and task prioritization. So I will practice how to balance multiple responsibilities without compromising the quality of the care of the patient itself. I've been developed strategies to maintain the physical and mental resilience, including structured sleep routines, short mindfulness breaks, and regular exercise like swimming, which help me recharge both physically and mentally. Additionally, I've sought mentorship from recent graduate and senior doctors to gain insight into common challenges and effective coping strategies. Because for me, I believe that preparation is not just about the knowledge itself, but also about building the habits that sustain the consistent and empathetic patient care.
So Nafal, can you describe a clinical situation during your training where you felt unsure or out of your depth? So basically, how did you handle it?
Um, During my respiratory rotation, I was caring for a patient who suddenly experienced a drop in oxygen saturation. Initially, I felt uncertain because the scenario was acute and I had not encountered it exactly before this. However, I recognized that patient safety must come first, so I prompted inform my senior, assisted in monitoring the patient and follow the intervention plan. So after the patient stabilized, I reflected on the situation and review the patient chart to identify the contributing factors. This experience helped me in that to encounter that feeling ensure is normal in clinical practice, but the key is to act responsibility escalate when needed, and reflect afterward to improve my skills. I also realized importance of teamwork and communication, which are crucial in ensuring the patient safety.
So now for my last question, what does patient safety mean to you in your day-to-day work as a house officer?
For me, patient safety is about anticipating the risk, preventing the harm, and ensuring that care is delivered in the most effective and ethical manners. Because in practical terms, it involves double checking the medical, the ensuring proper handover, monitoring for early sign of deterioration, and speaking up if something seems unsafe. So it is also means respecting the hospital protocols, collaborating with the teams, and maintaining vigilance even under the stress. So the patient safety is the foundation of trust, both between the patient and doctor and among others healthcare professionals as well.
Okay, so Nopal, I have one question for you. Based on your experience, how do you cope with physical exhaustion and also emotional stress?
Based on my experience, I cope with the physical exhaustion by planning some short breaks whether possible and staying hydrated while maintaining a balanced diet. I also prioritize my quality sleep even if brief during an intense rotations. For emotionally, I reflect on challenging situation and discuss them with mentors or peers I trust. Because I also engage in activities that help me recharge mentally, such as for sports and quiet reflections. So I think this strategy will help me in the long term to prevent burnouts and fatigue from this long hour shift.
So, who do you turn to for support when you feel overwhelmed?
I usually, when I feel overwhelmed, I will come to the senior colleague or mentors or peers who can provide some guidance or perspective. So they can give me some insight for the things that should I do at that time being. I also find that discussing experiences with like someone who has gone through similar challenge will help me process the stress, validate my feeling, and also to identify my practical solution. And I think having a reliable support network is crucial for sustaining the resilience during the housemanship period.
So now to close with, how would you respond if one day you were reprimanded harshly by a senior officer, basically in front of patients or colleagues? Can you respond?
In my opinion, I would remain calm and professional, and I would listen carefully to the feedback without reacting emotionally because I understand that the public reprimand can be difficult, but maintaining composure is also important to preserve the patient confidence and team harmony. And later, I would reflect on the feedback and discuss it privately if needed and implement any changes necessary to improve my practices. So I believe that viewing feedback as a learning opportunity for me to grow rather than a personal attack that will have an outcome for my personal growth in this medical journey.
So, thank you, candidate one. I wish all the best for you. So, moving to the next candidate.
Okay, so thank you, Rafael, for the first session. So now we will move on to the next candidates, which is candidate 2. Please introduce yourself and tell us about a clinical posting that had the greatest impact on your development. Please welcome.
Okay, so thank you. My name is Mawadah binti Muhammad Khairul Bahri, and I am an MBBS graduate from University Kuala Lumpur Royal College of Medicine Perak, or we know as Unicare RCMP. So one of the clinical postings that had the greatest impact on me was my internal medicine rotation. During this posting, I encountered a patient with multiple comorbidities who was deteriorating rapidly. So I had to prioritize which investigation to request, medication to administer, and which issue to escalate immediately. Coordinating with nurses, physiotherapists, and senior doctors taught me how to balance urgency with roughness. This experience strengthened my clinical reasoning, time management, and teamwork skills, and helped me understand the importance of thinking ahead for patient safety.
Okay, so which posting did you find the most challenging and also why?
For me personally, the most challenging posting for me was surgery, especially during emergency shift. I remember assisting in a patient with acute appendicitis who developed unexpected intraoperative bleeding. So the fast-paced environment was stressful, but it taught me how to stay calm under pressure, organize my tasks efficiently, and communicate clearly with the surgical team. So over time, I became more confident in anticipating the team's need, preparing instrument, and managing post-operative care, which improved both my discipline and clinical judgment.
So basically, Moda, please tell us about a time you work with nurses or allied health staff under pressure, basically.
Um, so during handover or emergency, I use structured tools such as SBAR to ensure important information is communicated clearly. I also recall a particularly intense situation during my pediatric rotation when a child presented in septic shock. I worked closely with nurses to stabilize the patient while the team prepared to fluid resusc- to prepare for fluid resuscitation and antibiotic administration. I learned the importance of clear, precise communication, calling out vital signs, confirming medication doses, and double checking orders. That experience taught me that teamwork and mutual trust can literally save lives.
All right. So basically, how do you ensure your clear communication between or among the staff you work with?
Hmm. Sorry, can you repeat the question?
So basically, how do you ensure your clear communication among the staff you're working with? It's okay. So for the next question is, if you witness unprofessional behavior by a colleague or a senior, how would you address it?
Okay, sorry. If I witness unprofessional behavior by a colleague or senior, I would prioritize patient safety first. And I remember seeing a scenario during my rotation where a junior colleague almost administered the wrong medication. And I intervened calmly, verified the orders, and informed the senior appropriately. I documented the incident objectively and followed the reporting procedure. So to reinforce for me the importance of professionalism and courage in safeguarding the patient.
All right, good answer, Mawada. So basically, my last question is, what would you do if your senior instruction, basically conflict with a hospital protocol?
I think if a senior's instruction conflicted with hospital protocol, I would respectfully seek clarification, explaining the guideline and my concern for patient safety. For instance, during pediatrics, a senior suggested a treatment dose outside the standard protocol, and I politely brought up the hospital guideline, and we were able to agree on the safest course of action without compromising team dynamics.
Okay, so how do you remain dependable even when tired or stressed?
Even when tired of stress, I remain dependable by preparing ahead, making mental checklists, and staying organized. During my night shift in medicine, I would often manage multiple critically ill patients. And by staying focused, pacing myself, and reminding myself that each patient relied on my consistent care, I was able to maintain performance without compromising safety. I believe that being dependable means thinking ahead, staying calm, and ensuring continuity of care no matter the circumstances.
Alright, thank you, Mawada. I wish all the best for the next round. So basically, moving to the next candidate 3.
Okay, thank you, Mawada. So now we will move on to the last candidate, which is candidate 3. Please introduce yourself and explain why you applied to UniKL RCMP Hospital.
Hi, my name is Nur Eliza Isha binti Muhammad Faisal. I am an MBBS graduate from University Kuala Lumpur Royal College Medicine, Perak, class of 2024. I applied for UniKL RCMP Hospital because of this hospital's strong emphasis on structure supervision, patient safety, and also training culture.
So, Eliza, what do you know about our hospital and its training environment since you applied this UniKL RCMP Hospital?
So I understand that UniKL RCMP Hospital value multidisciplinary teamwork, clinical governance, and also supervised learning.
Right. Yeah, Liza, basically the question from my side is regarding the adaptability and pressure management. So basically describe a situation, basically one situation where things did not go as planned.
So in a case of a sudden worsen, I will reassess the prioritize, and call for a senior help early so that I will not miss something, and also I will coordinate the nursing staff.
All right, Liza. So basically, when things get messy, basically, how do you prioritize tasks when everything feels urgent?
So I will prioritize my task by based on the acuity and then the potential harm and the time sensitivity, the time range, so that I know the time is short or long, and also while communicating delay clearly.
Right, good answer basically. Next is mistakes can occur during training. How would you handle making a medication error or missing a clinical sign, for example?
So first of all, I will ensure the patient safety, and then I will immediately inform my senior about the case, and then I will document the incident honestly. I will be honest and tell the truth, and also I will reflect on the step to prevent the recurrence in line with the hospital policy.
Okay, so this is my question for you, Eliza. So, where do you see yourself in the 5 to 10 years?
So in 5 to 10 years, I aim to become a competent medical officer with a strong foundation in patient safety, ethics, and also I will be professional.
So, how does housemanship at our hospital align with your goals?
So I already know this hospital supervision, and I feel that this hospital structure supervision align with my goal of becoming a safe and also a competent doctor in the future.
I see. So, I think this is the last question for you. What personal habit or mindset did you think you need to improve before starting this housemanship?
So I am working on managing my self-doubt by balancing the confidence and also humility and seeking feedback early.
Okay, thank you, Eliza.
Right. Basically, we will going through a group question for the all candidates. So basically, I think you guys must answer in turn, starting from the candidate one, followed by second, and last one is candidate third. So basically, the question is, what qualities define a safe, competent, and ethical house officer? Starting with candidate one.
In my opinion, I believe a safe, competent, and ethical house officer will comprise of combination of clinical knowledge, professionalism, ethical integrity, and emotional resilience. First of all, the most important part that for me is the competence and knowledge, the essential, which is a house officer must have a solid understanding of medical principles and the ability to apply them in real world situations. Uh, this include the conditions that require urgent attention and knowing when to escalate to senior colleagues. For example, during my clinical rotations, I learned that it's okay to feel uncertain about some situation as long as you act promptly, seek guidance, and ensure the patient safety remain the priority according the hospital protocol. And competence isn't just about knowing the right answer, but it's also making the right decision and informed decision even under pressure. And secondly, for me, the patient safety and vigilance are the top of the part. It is the core of the being of responsible house officer. The safety involved like anticipating potential risks, double checking the medication and procedure, and communicating clearly with both the healthcare team and also the patient. Because the risk is there, even a small oversight can have serious consequences, not only to the patient itself, but also for the hospital in the long term. So I think the attention for details is essential for to guide the patient healthcare. And then for the third is the ethical conduct and professionalism, which is for me is a non-negotiable because this is comprise the ethics like honesty, transparency, and respect for the patient, colleague, and the hospital itself. So it will maintain the composure in the stressful situation. For examples, um, if I receive some critical feedback or dealing with difficult family interactions, I will remain to become a professional to preserve the trust and models a good behavior for the team. And then for next, I think communication and teamwork is also the big part of the life of house officer because a house officer will never working alone, and collaboration with nurse, allied health staff, and some seniors are crucial. And clear handover concise update during emergency, and listening actively to colleague will ensure cohesive patient care and reduces error. As I also will learn more with them about to about the proper care for the patient. So they can also be my mentor, and they can guide me through this time, through the housemanship period. And then finally, in my opinion, the resilient and self-reflection will make a good house officer become a great house officer, because after the long hour, emotional encounters, and unexpected emergencies, um, being being able to manage stress, learn from the mistake, and adapt to challenging circumstances can ensure not only personal growth but also continuous improvement in patient care. For example, reflecting on past experiences, adjusting approaches, and seeking mentorship are some of my strategies that will help me strengthen both skill and confidence over time. So I think overall, a safe, competent, and ethical house officer will balance some knowledge, vigilance, professionalism, teamwork, and also resilience.
All right, thank you. So next candidate two.
Thank you for the question. For me, a safe, competent, and ethical house officer embodies a combination of medical knowledge, clinical skills, professionalism, and strong ethical principle. So, safety begins with having a solid understanding of basic sciences and clinical medicine, applying evidence based guidelines, and practicing careful decision making. It also means recognizing one's own limits and seeking guidance from seniors or specialists when necessary to avoid errors and protect patient well-being. Competence extend beyond knowledge. It includes practical skills, organization, and time management. A competent houseman ensures accurate documentation, timely follows up, and coordinated care with the multidisciplinary team, including nurses, allied health professionals, and consultants. It also involves vigilance in monitoring patient, anticipating complication, and prioritizing tasks to provide high quality care even under pressure. Additionally, ethics is at the core of every clinical division. An ethical houseman treats every patient with respect, dignity, and empathy, maintaining confidentiality and honesty at all times. This includes clear communication with patients and their families, obtaining informed consent, and making decisions in the patient's best interest without bias. Additionally, a safe, competent, and ethical houseman must demonstrate professionalism in interaction with colleagues, showing teamwork and accountability, and a willingness to learn from feedback. Resilience, adaptability, and continuous self-improvement are essential, as the houseman role is demanding and requires lifelong learning to keep up with medical advance. So ultimately, these qualities together ensure that patient care is not only effective but also compassionate, safe and ethically sound. Thank you.
All right, thank you. Moving to the last candidate.
So for me, a safe, competent, and also ethical house officer is someone who can take care of patient and while making a smart decision. So safety comes first. This means that paying attention to details like checking patient information, prescription, and also procedure carefully, and asking for help whenever something is unclear. And competent is not just about knowing medicine, it is also about being able to act calm in a emergency, prioritizing tasks, and also solving problem efficiently. So ethics play a bigger role in this issue. A house a house officer should treat patient with respect, listen to their concern, and also always protect their privacy. So being honest about mistake and learning from them is also very important because it builds trust and also build trust with patient and the colleagues. So communication and teamwork are the key qualities as well. Hospital are busy place. We know that hospital are busy place. So as a good house officer can work well with nurses, senior doctor and other staff to make sure patient get the best care. So finally, resilient, patient and also adaptability are essential too. Long shift, unexpected situation, and emotional challenges are part of the job. So stay calm, focus, and empathic helps maintain the high standard of care. That's all for me.
Okay, thank you. So I think, please, Mr. Razik.
Okay, so thank you to all candidates for your thoughtful responses. So based on I said during early interview, candidate will be evaluated based on clinical reasoning, professionalism, communication, attitude, and also resilience.
Right. So thank you all for attending. We wish you all success in your medical journey ahead. So basically, without further ado, I think let's move to the result announcement. The best candidate. All right. So basically, I have received your resume from Mr. Razik, and after going some assessment, and basically calculating your cumulative marks from your resume, and also from my observation during this interview. I think I have made my final decision. The best candidate for this interview going to candidate 1, Mr. Muhammad Naufal Hidayat bin Suhanda. So basically, congrats to Mr. Naufal, but also congratulations to Ms. Mawadah and Nur Eliza. And thank you very much for attending today's interview session. So basically, I think that's all from me. I will pass to Mr. Razik for closure.
Okay, congratulations. First of all, congratulations to Mr. Muhammad Naufal Hidayat. So, all right, to all, thank you. So, this we will proceed with the administrative process. So, official outcome letters will be emailed to the Mr. Naufal after the panel's endorsement and also completion the documentation. Further instruction will be included in the email. Okay, that's all from us. Thank you.
All right, thank you and good luck.
Okay, thank you so much, Mr. Razik and Mr. Ryan.